today to demonstrate how to administer subcutaneous injection.
My name is Febe Rigado and I'm the one who's responsible for video editing and directing and voice over.
I'm Albert Santos and I did the research part.
I'm Chris, and here's Melissa,
I did the first part of the preparation.
and I gave the subcutaneous injection.
Thank you.
Before giving any medication, you need to check the doctor's order and the MAR. And after verifying the doctor's order and MAR, it's time to gather all the supplies that you need. You will need a hand sanitizer, clean gloves. You will need a blunt needle if you are going to aspirate the medication from the vial, and a filter needle for medication from ampules. Syringe, but depends on the medication volume that you will need. Alcohol wipes for disinfecting the vial and the injection site. 2x2 gauze in case the patient is bleeding. Sharps container for your needles. And a monograph if your medication is compatible to be given in sub-Q. After collecting all the supplies, you will now ready for your first check. Prior to that, you need to check your medication to the monograph to check if your medication is compatible. From the doctor's order and the MAR, you will need to find the medication in monograph if heparin can be given subcutaneously. From the monograph, you can see the indication as well, the dose, the administration, the reconstitution, the dilution, and the stability. For the first medication check the expiry date, compare it against the MAR and the doctor's order, ensuring and verifying the patient's 7 rights. For the first check, you will need your MAR, your doctor's order, and the medication on the vial. So first, you check the patient's name on the doctor's order, patient's name on the MAR, the hospital number, and the date of birth, Next is the medication is heparin. Next is the dose is 5,000 units. Next is the route, which is subcutaneous injection. Next is the frequency is BID until fully ambulatory. So the order's date is Friday, which is today's date. So you'll see that the heparin is for initial dose at 10 a.m. and that is for the right time for the medication. Explain the medication purpose and documentation after. After the first check and ensuring patient 7 rights, you may now prepare the medication. Clean the vial with alcohol wipes for 30 seconds in circular motion. Connect the syringe to the blunt needle and inject air to the vial, a same amount of the medication volume that you are going to aspirate. Aspirate the desired dose that you will need and make it sure that there's no bubble in the syringe to avoid medication error in terms of the dose of the medication. After aspirating the right dose, you may now change the blunt needle. And then prime the needle and avoid contaminating it. You can now do your label on the top of your MAR with your medication on your hand to make it sure that you have the right volume and ensuring the patient's 7 rights. Afterwards, you can do the second check, ensuring the patient's 7 rights while comparing the MAR with the medication, with the label, and the medication itself to make it sure that you verify patient's 7 rights. For the second check, you will need to have the MAR, medication label, and the vial comparing to each other. So first is state the name with the MAR and the label, hospital number, and date of birth. Next is check the medication if you have the right medication, which is heparin, heparin, heparin. Next is the dose, which is 5,000 units, 5,000 units. So when you look at the medication, the concentration is 10,000 units per ml. So we aspirated 0.5 ml according to the computation. Next is the route, which is subcutaneous, and next is the time, which is BID, or twice a day. When you look at the MAR, this is going to be the initial dose because today is Friday and they ordered it on today's date. So you're going to give the medication for initial dose. And then don't forget to state the reason why you're giving the medication and document after you give the medication. After hand hygiene ensuring patient safety, you can now introduce yourself, your duty, and your purpose, and ask for ID ban. And as a patient for 2 identifiers, you can do your 3 assessment as well, and you can compare your medication against the MAR and the ID ban. After ensuring the third check, you may now locate the injection site. After locating and assessing the site, do hand hygiene and wear gloves to disinfect the injection site with alcohol wipes. Clean it in circular motion for at least 30 seconds and let it air dry. Before injecting the medication, warn the patient and distract them by telling them to wiggle their toes. The degree angle of injection is between 45 to 90 degrees. Depends on the subcutaneous fat and the needle size. Pinch an inch. Inject the medication for at least 1 ml for 10 seconds and hold it for another 10 seconds for proper absorption, and throw the needle into the sharps. If the patient has less subcutaneous fat, such as elderly, babies, and kids, you want to inject at 45-degree angles for proper absorption in the subcutaneous tissue. And if the needle is longer, you need to inject at 45-degree angle. Remove your gloves and do the documentation. Before leaving the patient's room, you need to give them at least 3 teaching and tell them you're going to be back after 30 minutes to check out on them, and ask the patient if they need anything else, give them the call bell, and ensure they are safe.